I'm having a few athletes tell me that they're having soreness in their hips and lower legs, so I want to shoot a quick video to show how to stretch and also treat yourself using trigger point. So we're going to start with the stretching of the hips. What I want to do first is stretch the glutes here. So I want you to bring your knee first to your opposite shoulder in a good posture position. So you would hold each of these for about 30 seconds to a minute. You would switch and do that on both sides. Then I want you to lay on your back and actually bring your foot to your chest, always keeping your knee at 90 degrees. We don't want to bend here because you'll cause a twist in your knee that might hurt your meniscus. So first, knee to chest, then foot to chest to stretch different parts of the glute. Then we do a split stretch where you essentially try to get as far as you can, stretching both your hip flexor here and your hamstring while leaning away from this back leg. So you would do that again for 30 seconds to a minute. When you're done with that, then go into straddle position. Again, go as wide as you can, 30 seconds to a minute, then split this way. Okay? The next one is for the calf. Essentially, you want to just push your heel down toward the ground like this. I like to contract the front of my leg so you're pointing your toes towards your face so that pushes your heel down in and gets a little bit better stretch. Another way to do that is to hang your heel off a curb or a stair. And then the last one is essentially bending your toes back like this. You get your toes as close to your knees as you can, and then you sit back on them like that, trying to bend out and in to stretch what are called the intrinsic muscles of your feet. Again, all of those for 30 seconds to a minute. When doing trigger point self-treatment, you want to focus on using the stiffest, strongest, hardest product you can to treat yourself. So if you can tolerate something like a lacrosse ball or a really intense foam roller or PVC pipe, do that. If you can't, then you peel back to something that you can tolerate. Sometimes I have people start with a tennis ball. If their muscles or tissue is too tender, then this is a good start. But essentially, this is the softest thing I would ever have you work on. A racket ball or anything softer like that just isn't effective. So you can use an old tennis ball, then a new tennis ball because they're a little harder, then something like Trigger Point Technologies ball that's nice and big. But a lacrosse ball, usually both of these are sufficient. And we use these in certain areas, and I'll show you during the rest of the video how to do that. Same thing with rollers, that this is nice and soft. It's a closed cell foam, or I think this might be an open cell foam. But then there's a product like Trigger Point Technologies that has a hard plastic on the inside with a little bit of cushion on the outside. And then their quad baller, which is smaller in diameter and a little harder, which makes it significantly more intense and yet more effective for certain areas. How long to roll depends on how tight your tissues are. So if you're really tense and things are in spasm, it might take you 20 minutes or an hour of treatment to loosen everything up, or multiple treatments over multiple days just to get everything loosened up. But as a general rule, as you're using trigger point or foam rolling, you want to roll the tissue to find the spots that hurt. And once you find the spots that hurt, you sit on them for anywhere for the minimum is 10 to 15 seconds, but usually at least 30 seconds, up to actually 4 minutes. So let's say I've got a spot right on my hand that's really tight. I might roll that area, find the spot that it's right there, sit there for the maximum would be 4 minutes, let off for about 20 seconds to get blood flow through there, 4 minutes, let off 4 minutes. So the maximum I can treat this area right there is 12 minutes in 3 4-minute intervals. Now, I can go directly adjacent to that. You know, if this is the size of a nickel, I can go over just like that and treat the same thing for 12 minutes. So it would take, a few hours to treat my whole hand if I did 12 minutes in each spot. So the reality is, usually people do too little treatment rather than too much. I've only had 1 or 2 patients over the last 16 years do too much. So if it hurts, keep pressing, but only press for 4 minutes at one time. To optimally roll your hip, what you want to focus on, first, anatomy lesson. So there's a bump on the front called your ASIS and a bump on the back called your PSIS, and then you've got your hip bone, your greater trochanter here. So those are going to be your landmarks, and the iliac crest comes up and over here. We're going to work one muscle here called the TFL and glute minimus that runs from the front here to your lateral hip here, and then in the back we've got glute medius right here, that bump that is so sore when you've been down sprinting, and then piriformis in the back. So let's start with TFL. You will essentially put that ball right where that muscle is and put your body directly on that like this, and then bend your knee up like this, keeping your bottom knee bent like this and this foot flat on the ground. Okay? So now you roll until you find the most painful spot. I hate to say that, but that's what you're looking for, is discomfort. If it doesn't hurt, you're not in the right spot. Okay, you've got to roll until you find some discomfort and pain, especially if you're having pain. You want to find that pain and press right on it and sit there. Okay, so as I roll around, you find the worst spot, you sit there, you hold that for anywhere from 30 seconds to 2 minutes. Okay, and then after you've done that, you roll around a little bit more to find out, is there another spot that is more intense or more tender, because usually in that time it has relaxed and reduced in tension. So after you've done the front part that runs from your ASIS to your greater trochanter here, now we're moving more to the back. So you put that right back there, then find that spot again, sit right on it. So this one, your leg is straight, whereas the last one it was bent. This is still flat on the ground to basically add or decrease pressure. So again, you're rolling to find that spot. Once you find it, you sit there and hang out, and you should just press in there, and it should be uncomfortable, especially for a track athlete. Any runner is gonna feel that. So this one is glute medius, which if you put your hands on your hips like this, it's where your thumbs go. Basically just like that, is just below. There'll be a circle in there that feels very tender and sore in track athletes. And then lastly, the piriformis, which runs from your sacrum right here. So again, the PSIS is right there, and the sacrum comes down like this. So halfway between those, it runs from there to your greater trochanter and comes back right in the middle of the glute. Okay? So you would put that right in the middle of the glute, sit right on it like this. Again, straighten the leg and roll around till you feel a spot that is quite intense. And once you find that, you can roll a little bit, but again, rolling is looking for the tension. Treatment is sitting right on that spot that hurts. Next, we'll roll your quadriceps and hamstrings. The quadriceps are best done face down like this. This area is difficult to roll, as is up here. You're going to get the most benefit out of the middle. The quadriceps muscle starts here and actually comes all the way around to even farther back than halfway. It's a little bit back there, so you'll have to be all the way on your side to get the whole thing. So I'll start on this side, but essentially when you're doing foam rolling, you want to do a plank on the roller. So you just slowly roll to find what's most tender. When you find it, you just sit there and press on it, just like any other area. Once you get, I'm going to switch sides here, once you get over to the side, then you've got to be all the way on your side like this, and you're not contracting the muscle. It's really important that you relax the muscle as much as possible. Otherwise, a contracted muscle you can't press into and get any blood flow in. It's contracted and tight like a squeezed sponge. You've got to allow that to be relaxed so you can press in there. But yes, relaxing the muscle will hurt more, but it's much more effective. So you basically roll just like that, very slowly, looking for the spots that hurt the most. Once you find them, you sit there and just gently roll on that. So that's how you'd roll the quadriceps. The hamstrings are best done from a chair or on a countertop with like a yoga mat. The best scenario I've seen is sitting on a countertop with a yoga mat over it and a rolling pin. That's the best I've got for a rolling pin, but essentially you would put it right on your hamstring like that, and then roll back and forth, and then get a little bit of stretch where you're pressing on that area. Then come up a little bit, same thing, roll the area like that, find an area that's really tight, and then stretch it. So that's the best for the hamstring. What I usually see people doing is something on a chair where you've got a roller like this and you're just rolling like that. The reason the chair works better is that if you're on the ground where you're all the way straight, it's difficult to get enough pressure in there because the hamstring is now stretched. It's a little bit taut. So when you're seated, the knee's bent and that muscle's a little bit more relaxed. To roll the gastroc and soleus and Achilles and plantar fascia, you would start on the ground. Again, this is probably more tolerable, even though this is more effective. And another option, once you can easily tolerate a regular foam roller, is to get 2 lacrosse balls and tape them together. That works pretty well to basically put your body weight on just like this. And oftentimes what I'll do is actually set this on a book or something, because when you do it this way, your heel drags on the ground, and when you put it up on something, now your heel can roll gently like that, and you can get both muscles treated pretty well. But I'm going to show you on this that essentially you roll all the way from your calcaneus, your heel, all the way up to the back of the knee, and you put as much body weight as you can tolerate, working the inside and the outside again, looking for what's most tender all the way through the whole muscle. You're going to find that this area is the most tender, and you'll find that you'll have the most pain in that area. So that's how you roll gastroc, soleus, and Achilles. And last but not least, plantar fascia. You can use a tennis ball or lacrosse ball. And just to show you a healthy plantar fascia, you should be able to put all of your weight on a tennis ball and maybe even a lacrosse ball. That I'm not saying I can stand on this easily, but my plantar fascia is not irritated right now, and I can put a significant amount of stress and pressure on that. If you can't, that means your plantar fascia and your what are called intrinsic muscles of your foot are really tight and need a lot of work to loosen them up. So what I would do is just all the way from your what's called metatarsal phalangeal joint, so right in through there, all the way to your heel, and then out a little bit. But this entire area is what you want to treat, just in a standing position where you are pressing just like that and slowly rolling back and forth, trying to find the spots that hurt the most. Again, stopping where you're feeling the most tenderness. I hope this has been helpful. If you have any questions, please give me a call, text me, put a message in GroupMe, and we'll workshop it and figure it out.